whatever intervention you are looking at, the effects, the effectiveness, what we call effect size, is going to be the same. So if you look at psychological care, manual therapy, whatever sort of intervention in manual therapy, exercise, if you look at mindfulness, acupuncture is quite similar. All of these, they have, fairly small to moderate effects, which means that's why if you are in pain today, in the streets, you will see lots of different practices offering lots of different professional services. And all of these people make a living because they all do their best they can, but there's not like one winning sort of, intervention. So the spectrum you were talking about against manual therapy and for exercises, there's really good evidence saying that, giving exercises to everyone doesn't work. Patients who've been in persistent pain, when you do qualitative work, I haven't done that, but there is qualitative studies out there asking them, how do you feel when your healthcare professional says you should be doing exercises? They hate it because they've tried it. It was really painful. And maybe they have, I remember some participants who were overweight and they said, I can't really feel the idea of me putting a Lycra on and then going to the gym. It's just, a no-no. And so having an approach which is much more personalized to the patient, and yes, trying to promote them becoming autonomous and being physically active, of course, that's really important. I think no one would disagree with that. But saying that, manual therapy is going to be the opposite of, I think it's really, that's social media sort of narrative. Yeah. And one final thing I'm going to say on that, because I feel passionate, as you can see, about it, is often the argument that he says is that manual therapy is going to make patients dependent.
Yes.
And that's a big argument from people who are all about exercises. And the only trial, as far as I'm aware, that looked at that, and they did exercises which were framed within a biopsychosocial model versus manual therapy, which was framed within a biopsychosocial model. And then they looked at how many sessions these people had, outcomes and all of that. Basically, they found no differences. In the sense of same number of sessions, I think it was between 4 and 6, I can't remember, outcomes and everything. So there is no evidence out there that suggests that if you do manual therapy, then the patient is going to come for a very long time. I'm French, as people can probably hear, and in France for a very long time, and still now, but a bit less, if you went to the physio, you would have heat lamp, you would have 20 sessions, you would go back to your GP, you'd get another 20 sessions, and that was really common. That was the sort of way in physio it was working. To me, that is dependency. That is where, it's really pointless as a care. It's a waste of resources.
Yes.
It's moving away from that. Physio is really, really...
France or everyone?
Yeah, in France, it's really improving. So just saying it was a long time ago what I'm talking about, okay? But if you compare that sort of passive care that doesn't really give anything compared with manual therapy, which I disagree is passive care. I think patients are involved during, can be involved during manual therapy. And if you add advice and, reassurance and exercises and all that, yes, within a few sessions, they feel better, they go back into their life and all of that. To me, I can't really see this sort of dichotomy of passive and active being very useful.